Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
Hi, everyone. Dr. B and the famous Dr. G here today for another episode of our AMG Vitality Vault podcast. So today, Dr. G, we're just going to start off with your socks.
Yes.
Let's just open it up and see what he has for us today.
Fantastic. Today I'm wearing my crazy cat dude socks. See, there's a picture of a black cat on there, crazy cat dude. So I'm wearing my crazy cat dude socks because the topic today is important, because if we don't address this, if we don't get this in gear for my guys out there, they're going to end up becoming crazy cat dudes. So I think it's important for us to work on male hypergonadism and testosterone. We're going to go through overview and management, what it means. Perfect. And basically, hopefully, the goal behind today's topic is to give you a better understanding as to what these two terms mean, what it is to have testosterone levels, how what we should be doing in terms of optimizing and basically keeping those levels healthy.
Important, yes.
Very, very important. Let's start off with what exactly is testosterone. So it's obviously the male hormone. We know that. Now, women have it too.
Yes.
But in today's talk,
everyone needs it.
Everyone needs it, yes. So by definition, it's a primary male sex hormone made by the testicles. Right? Now, there's different forms of T. We know that in the bloodstream, we have two different ones. We have total testosterone and we have free testosterone. The difference between the two, total, think of total as your huge school bus of testosterone. And think of the free testosterone as the kids in the school bus or people in the school bus. That's the one that can get out and go where it needs to go.
The active ones.
The active ones, the kids, the active form of the hormone.
Yes.
So when we typically measure testosterone levels in our clinic, we do both because it's good for me as a clinician to know, okay, if the client X has a potential testosterone issue, which fractions am I going to be adjusting, or how will I be approaching him based on the fractions he has in terms of total and free? Important to do. Free testosterone, it does impact muscle growth, bone density, and we'll go through a few other health benefits of having optimized that. Everything we do is meant to optimize testosterone function and levels in the body.
So why does testosterone levels matter? I think you went through a few of these already, yes. Dr. G, but it does have a physiological role to help with muscle growth. So definitely your muscle mass, and I know that's important to most men, for sure. Bone density, so avoiding going into osteopenia or osteoporosis, just keeping that bone nice and healthy, because we have testosterone receptors on our bones.
Yes, we do.
Of course, libido, that's something that as we age, both men and women, we want to make sure that we're optimizing our hormones. Testosterone is very important for libido, and definitely our energy levels is to keep us, doing what we're used to doing, keep us going in the gym, keep us going day to day with our activities. And of course, the risk of low testosterone would be the opposite of the above, or fatigue, reduced libido, loss of muscle mass, It does affect our mental capacity as well,
it does.
too. So we'll see a lot of depression coming out of this. If, you have someone that's suffering from low T, that is one of the symptoms. And it can manifest itself as just kind of
mood issues.
Yeah, just not and fatigue. I think a lot of people, their mood issues do exhibit themselves by just not having the energy to do anything. It's both a mental and physical aspect of it.
The aging process, right? That's the hormonal dilemma. Everyone always says, oh, doc, you know what? It's just me getting older. And we hear this a lot. But Dr. B and myself, we've come across clients who are well into their 70s and they are not suffering with hypogonadism. Now, to be clear, the definition that we use for hypogonadism is basically when a man has a testosterone level less than 300. And this is going by the AUA guidelines, which is the American Urological Association guidelines. So, and that's usually done on 2 consecutive blood draws. So we draw one, we see it's low, preferably fasting in the morning. We draw a second one and it's still low. And as long as you are below that 300 threshold, that's all it takes to get the diagnosis of male hypogonadism. And obviously with us and all other clinicians, you want to look at more clinical symptoms as well. With aging, you do see, or you can see, reduction in the Leydig cells. Now, what's your Leydig cell? Your Leydig cell, those are the cells in the testes that actually produce testosterone. And so those cells are really, really important, and they can begin to diminish or become malfunctioning as we age because of external factors, diseases, and we'll go through a couple of those in a little bit so you can see. And with a decline in free testosterone, you can see an increase in SHBG. Now, what is SHBG? That is basically sex hormone binding globulin. That is the protein that binds testosterone in your blood. It's supposed to. And it's not the only one. Albumin as well, which is not a protein, both of those kind of hold on to testosterone. So the more SHBG you have in the blood, the less likely you are to have more free, unbound testosterone for you to utilize for daily physiologic function.
And that can actually be tested on labs, SHBG. And if it's too elevated, there are things that we could do to help to lower that. Because as we lower that level, then more of that testosterone becomes in the free form where it's more readily available. So you can use it. So that's another important one that we will look at when we are checking your lab values.
So there's some common causes. Now, when we think of hypogonadism, right, there's primary and secondary. Primary usually is more of the genetic early onset situation. So one is Klinefelter, that is when you have XYY, that's a syndrome. There's also injuries that can happen very early, whether it be through trauma or infections like mumps. Mumps orchitis is one caused by the paramyxovirus. That one can definitely lead to long-standing issues with testicular function because of the injury. And of course, the autoimmune disorders. So whether it is an autoimmune thyroiditis, whether it is lupus, rheumatoid arthritis, all autoimmune maladies can negatively impact your hormone functioning in the body. And those of us unfortunate enough to have been exposed to chemotherapy because of a cancer journey, guess what? Yes, you're at risk, and obviously alcohol, toxin. The more you put in your body, the more you disrupt the chemical signaling, and the more likely you are to have issues with hypogonadism. Now, when we talk about secondary, those are the ones that happen a little bit later. Now, there can be some congenital ones too. We're looking at Kalman syndrome here, which is actually one that happens because of a GnRH deficiency. So that is that big hormone that comes from your, if I'm not mistaken, your hypothalamus, and it tells your pituitary gland to make LH. LH then tells your testes to make testosterone. So you take away the big hormone, GnRH, guess what? There's no signal going anywhere. And you're not going to be making any testosterone. So that's what Kalman syndrome basically is. There's also pituitary tumors that can cause that. You're looking at hyperprolactinemia, which is excessive prolactin, which can be caused by tumors as well. And also medications. So a lot of patients now, we know there's a huge opioid pandemic. A lot of patients who are on chronic opioids, they tend to have difficulty with testosterone function because the opioid itself messes with that hypothalamus pituitary adrenal axis. You mess with that, you're not going to produce anything. And let's talk about substance abuse. Look, alcohol again on the list. And also some illicit drugs can definitely negatively impact your production of testosterone.
prevalence of low testosterone.
Yes.
So age-related, like we talked about, as you get older, it tends to decline. This is all dependent on your lifestyle.
Yes.
Of course, the things that you could do to try to maintain a healthy level. And you can see here for the stats, 38.7% of men over the age of 45 do suffer from this.
Wow.
There's some of it that is secondary, but usually and a small percent that is primary at that age. But typically it's a more of an age-related decline. Obesity is a big one that can definitely lower your testosterone levels by different ways, actually. Yeah. And you could see over 50% of obese men suffer from this. Obesity is strongly linked to metabolic factors. These come into play when we're talking about low T as well, too. Diabetes and chronic illnesses. It says obesity here again, and diabetes kind of almost goes hand in hand with obesity with most of the patients that we see out there. And so just diabetes alone, the inflammatory nature of it, the metabolic nature of it, different processes can lead to low testosterone. So something that we commonly see in those patients. And then you've got some systemic illnesses that can contribute to this. We talked about
chronic kidney disease can do it.
Yeah, absolutely. And then we talked about autoimmune disorders, which are typically chronic, and inflammatory, and so can cause reduction in the production of the testosterone in the testes. Reduction in your LH production. So many different processes that can lead to low T production.
So symptoms, we talked about these before. So you're going to have low libido. You can have ED, poor morning erections, which can happen. These are questions your doc will ask you. Physical symptoms, decreased vitality, which is feeling just weak and tired. Increased fat mass, that's important. You can see that as well. Decreased muscle mass, your strength is going down, you're not pushing as much. And obviously mood is a huge one. So when you're diagnosing male hypergonadism, like I said, if we use the AUA criteria, it's a T level less than 300, typically on 2 separate occasions. So once we do this, then we do more digging as to why this person has that. So it's a stepwise approach. You want to see if it's a failure to produce it, or it's caused by a testicular disease. So we can't take you through the process of diagnosing and doing the history and physical and doing the blood work to see exactly how we tackle this particular disorder when it arises.
Testosterone replacement, very important in men. Obviously, if you're suffering from these symptoms, replacing it safely can definitely help. Helps with sexual function, libido, muscle mass, bone health, like we talked about. Definitely a big one, mood improvement. And anemia is one of those that can actually be caused by low T as well, too. So just correcting that. Some potential risk that has been seen with some testosterone replacement would be cardiovascular events. But actually, low T does put you at risk for cardiovascular events too. But, if you overshoot your replacement, and that's why you have to find a doctor or provider who knows about hormone replacements and does it safely, then you can reduce these potential risks here.
And to be honest, and you will hear it in the actual ethos that, you're increasing your risk of prostate cancer. To this date, there is no solid evidence to show that testosterone replacement therapy, when done physiologically and when done to optimize you towards normal functioning levels, has not been shown to increase the risk of prostate cancer at all. So I know there's more studies out there coming down the pipeline, but the idea behind TRT is to be physiologic, meaning keeping you normal. We're not shooting to have a T level of 1,500 to 2,000. We would prefer you to be within that good range, and you obviously will do stuff to maintain that It's not just the medications, it's a lifestyle change too you have to adopt.
If you do have a diagnosis of prostate cancer prior to replacement, though, you don't want to replace in that patient.
That is
because
correct.
it can feed the cancer.
There's a potential for that,
But
yes.
as you said, like being a risk factor by itself to put you at a higher risk of prostate cancer is, that's not supported by the literature.
Mm-hmm. So when we talk about TRT, we talk about types, right? There's different ways to get the testosterone in the body. So the big one everyone knows is injections. And that by far is probably the most effective way. And that is usually with testosterone cypionate. That's the one that we typically use for injection. The difference between that testosterone and your natural one you make, the chemical structures are a little bit different. So, but it's the one that's available that we use. Another option is gels and creams, which you can use, and those are more the bioidentical, which we tend to use a lot of in our practice. Those are a bit more tedious. You have to put it on the skin, and there is a risk of transferring to others if not done properly. Patches are also topical, so those go on the body, and then that's one you can use. Pellets, that's when we do a small procedure in the office, a small incision, and we place just subdermally, we place some pellets of testosterone that actually get released slowly over time, and they are in response to cardiac output. So basically, the more you are physically active and the more you work out, the more you will use that testosterone, which makes them a whole lot better for long-term use. And then, of course, oral tablets. Now, in the past, we didn't really like using oral tablets, but they've made some pretty cool advancements in testosterone therapy. And I think the one that Dr. B and I came across was testosterone undecanoate. And that one is actually an oral version of testosterone. Now, we tend to avoid oral. Why? Because of the first pass system. That's when your liver breaks things down in a way that's not very good for you. The trick with the newer orals that we have come across is that they don't go through that first pass system. They actually get absorbed through the lining of your small intestine. So they bypass that, and then they get into your system, and then they do their good work. So there are newer things on the horizon for treating, and it's amazing to see that the science is advancing the way it is. So it's all about giving people options to be able to make the right decision. Now, if TRT is not an option for you, for various reasons, there are other things you can do. One is clomiphene citrate. That's the brand name, I think, is Clomid. Yes. And that one is basically, it increases your endogenous testosterone in the body, and that is through the HPA axis. It increases GnRH, which is the big hormone that sets everything off. HCG. Most people know what HCG is because of weight loss back in the day, right? So that one stimulates testosterone by the same mechanism as the Clomid, basically. Aromatase inhibitors. Now, what those do, those are like the anastrozole and the letrozoles. Those will reduce your estrogen and then increase and boost your testosterone because they block the converting. So aromatase is that hormone that turns testosterone into estrogen. So by blocking aromatase, which is the inhibitors, you can boost your level of testosterone. GnRH therapy, we talked about it, that stimulates your pituitary hormone release. And SARMs, which are selective androgen receptor modulators, those are just basically chemicals that attach to the actual testosterone receptor and do the work of T. So I mean, all these are options for those who are not candidates for testosterone therapy for whatever reason. So just to give you that knowledge and power, do your research and check it out.
So those were the prescription ones that you could use and as alternatives to testosterone replacement. Now we have supplements.
Let's do the supplements.
Because of course, you might want to try one of these supplements first before going to a prescription option, right?
And of course, talk to your doctor. Talk to your doctor or qualified healthcare professional. Let them know what's going on. Let them know what you're thinking about doing before you dive deep into any of this stuff.
Absolutely. So we have at the top of the list here one of my favorite supplements, vitamin D, because there's so many benefits from vitamin D. It's one of the big benefits is supporting overall hormone synthesis and is definitely involved in testosterone production.
Because vitamin D, Dr. B, it's not really a vitamin. Most people don't realize it's actually a hormone.
It's a hormone. It's
actually a hormone. The chemical structure of vitamin D is a cholesterol, and the way it works is pretty much like a hormone.
Absolutely. So you make sure that, and this level is easily measured on blood work. So you want to make sure you work with your doctor and you achieve a healthy level of vitamin D.
Yes.
Zinc is important to actually produce in the production of testosterone as well too. Now, if you take in high levels of zinc, you want to check with your doctor and levels as well, because with zinc, if you're doing high levels, you're supposed to replace with copper as well.
That's right.
High level zinc can reduce your copper level in your body. Magnesium is another one of my favorites. Magnesium.
Wait, I thought I was your favorite.
Oh, supplements.
Oh, I thought I was your favorite supplement.
I have no idea what's going on here. But magnesium has a lot of function in the body. Again, hormone production is another important one of it. It helps with muscle as well. So it kind of goes hand in hand with testosterone. It helps with mood and relaxation. So it works, it goes hand in hand with all of our hormones, to be honest with you.
It's a good cofactor.
Yeah. And these are all my favorites right here. I'm going to stop at ashwagandha though, because that's a big one. That's a big one. That and if you listen to the podcast, you'll hear us talk about these ones over and over again and the different benefits. But ashwagandha. It helps to lower cortisol. We refer to it as an adaptogen. That helps to balance our stress levels, and anything that obviously stress throws our hormone levels off. So reducing the stress effect on the body is going to be really important. Ashwagandha is great for doing that.
Now, when you break down the others, so D-aspartic acid is actually an amino acid. And there's two types. There's L and there's D. The L is levo, D is dextro. So the D-aspartic acid actually does help to stimulate LH production. And that's good because LH then tells the Leydig cells in the testes to make testosterone. So that is an over-the-counter supplement that you can get and you can use to see if it helps to increase. And there are a couple small studies that did show that using this and also the rest of those on the list can help to increase overall testosterone levels. And now these studies were looking mainly at the testosterone themselves, which was good. But most of them didn't talk about function. So function's a little different. So seeing levels go up is one thing, but now we got to utilize it. So they got to make other changes in their body and in their lifestyle to be able to utilize that testosterone. Fenugreek is actually, it's a herb, a plant-based herb, and that one reduces the conversion of testosterone to estrogen. The way it does that is that it blocks, if I'm not mistaken, DHT, and it has 5-alpha reductase activity. So it works like some of the prescription medications we use for patients for who have enlarged prostate. By blocking 5-alpha reductase and blocking DHT, you can see increases in testosterone. Okay, boron, a metal. And we know boron has been used to help enhance free testosterone levels and reduce inflammation. So it's one that's commonly used, I think, by guys to help with their natural testosterone to help boost that. Omega-3s, as we always say, anything that reduces inflammation is good for the body. And that's what omega-3s do. Improve hormonal balance by reducing overall inflammation. The last two are pretty cool. So Shilajit, it helps to boost energy and testosterone production. It's actually it's a herb itself. And that one is, I think it's from Asia. So that's a good one to be on. Tonkat Ali, it's actually Muhammad Ali's second cousin. So, no, it's not? I've been sitting on that joke for days now. So let me have that one. Let me have that one.
You were just waiting for the moment.
Let me have that one. I've been sitting on that dad joke for days. I didn't tell her because she would tell me not to say it. So I did say it. Crisis averted. So let's go back to So Tonkat Ali, another one that enhances testosterone and libido and helps with stress resilience. The last two are really good herbs, and they're from from Asia, and they're things you can get over the counter. And it's actually part of the diets over there in Asia. So we're big in using natural supplements to be able, but not all supplements are good for you. You want to make sure you do your reading, do your research, talk to your healthcare provider, see what's good for your body, do proper testing, because remember, a lot of these have to be broken down by your liver. So if you're someone who's doing other stuff that's not liver friendly, like eating processed foods, drinking too much alcohol, smoking, or not losing weight, so staying obese, then you're putting your liver under more stress than it needs to be when you take too much of some of these supplements. So while they're good, moderation is key, and knowing exactly what suits your body is the best way to move forward with regards to optimizing your testosterone levels.
Some of these natural supplements can interact with each other too.
They can.
So you want to check with your doctor again and make sure that you're not taking something that's not going to work well with, something else that you're already taking. So, just you got to be careful, not because they're called natural supplements means that they're all safe to take in large quantities or with each other, etc.
This was a quick talk, and we just kind of wanted to touch a little bit on low testosterone / male hypergonadism, so that way you, as the listeners and the viewers, can learn something, and be empowered to make decisions for yourself. So if you're a guy or if you know a guy who's dealing with some of these symptoms and he's not sure where to go, have him have that conversation with his doctor. Hey, you know what? Talk to your doc and see if maybe you should get checked for low T. I mean, doing a full evaluation, it may not actually be low T. It could be something else. But at least you put it on your board, on the radar, as a potential cause of what you could be dealing with. And if you have chronic conditions that are negatively impacting your testosterone level, work really hard to make those changes.
Yes, I think this was a good one.
It was a good one. It was a good one.
Absolutely. All right.
So I think we are good. No crazy cat dudes. We'll keep it good, right? Get your levels checked.
Absolutely.
Eat healthy. Exercise. Do what's right by your body.
Lifestyle is very important.
Lifestyle is key.
With all hormonal health.
That's right.
Absolutely.
Thank you so much, guys, for joining us again in the AMG Vitality Vault. I can't wait to get you guys back in the vault and on our next episode.
We will see you next time.
Take care.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.